Yeah, I mean, I think there's a number of issues about pharmacy services. Firstly, what we're dealing with here mainly is minor illness, and a lot of our work's taken up in just reassuring people. This is work that could easily be met and should be met through an extended role of pharmacy, especially with review of sort of minor illness. And our experience is that that's not being taken up by the students, and perhaps not even being promoted by local pharmacists. But it would make a huge difference, I think, to the quality of service that we could provide if we had something like a community pharmacist giving out basic minor illness advice. The other areas of concerns that we have is that about 20 or 30% of our current list are international students, and clearly they present there's issues around communication, health-seeking behaviour, their previous experience of healthcare services, and this is a kind of niche that is not being met or served at all by local pharmacists, and it would be very helpful, I think, both to the universities but primarily to the patients, if we could find set up a pharmacy that found some way of addressing these needs and fundamentally looking at communicating with this population. I know the university have made some commitment to work with the pharmacy to develop materials for this group. We were very disappointed because the Berkeley Medical Centre had been envisaged as not only being a practice but also a pharmacy, and we felt very let down, unfortunately, by the health board, because the initial plans and agreements had been that a pharmacy would be on site, and that's very much the model that we had worked towards. And there's obviously an area that's been set aside for pharmacy, and the pharmacy representatives were involved in the inception and the planning. And there is a need, there is a niche, there is a it's not just a question of desirability. I believe there is unmet need for the student population, and we would very much like to work with pharmacy to develop that, and that may be obviously looking at kind of sexual health and contraception, but very much extending the role of pharmacists generally. And I think the students are a different group, and that should be recognised. A lot more that pharmacy could do. I know they've extended the role of pharmacists in recent times, but my brother's as a young pharmacist, and it seems ridiculous in some ways that the skills of pharmacists aren't being utilised, and it's not obviously about dispensing. And this is an ideal population where new services and pharmacy could be developed in different ways, in a model perhaps that might be, I suppose, copied across the country. This is a real opportunity, and a real opportunity for pharmacy as well.
My name is Shona Robertson, and I'm the head of the Disability Service here at the University of Glasgow. We have nearly 2,000 students every year who disclose that they have a disability or a long-term chronic health condition or mental health difficulty, and many of these students will need to have and use prescribed medication on a regular basis. And at present, I feel that the pharmacies within the neighbourhood area don't fully meet the needs of disabled students. For example, I can't think of a pharmacy locally where there is disabled parking nearby. If we had a pharmacy at the Fraser building, then we have got disabled parking very close by, which students can access easily. Also, the doors of local pharmacies, I'm thinking of the one in Byres Road and the other ones in Great Western Road, Dumbarton Road, Argyle Road, they are non-automatic doors. At Fraser Building we have automatic doors, so any students who have difficulty with heavy doors won't have that problem. And then furthermore, the pharmacies that I'm aware of locally in the area have limited space, and there are extensive waiting times, often particularly at peak times in the lunch hour, and there is inadequate seating in that waiting area for disabled students, and they can't be expected to stand for long periods waiting. There's also issues of privacy as well. there isn't the accommodation, I don't believe, for them to have their needs discussed in private without it being in earshot of members of the public. So all in all, I think it would be a really good idea if we were able to have a pharmacy on campus for the needs, to meet the needs of our disabled students. Their support is their medication. You know, if you've got diabetes, you may not need support with your coursework or on course or study skills, but the support that's vital to you is regular access to your medication. There will also be a larger number of students who will have a chronic medical condition, but who may have chosen not to disclose to the university.
And what are the other difficulties about access to the local pharmacy?
Well, the main one, the one that's on the route to student residences, you know, Queen Margaret and Wolfson Hall, where they would walk by it every day, or the one that's opposite the subway station in Hillhead, which is the main station used by students. It's the access, the actual access in front of that pharmacy is totally unsuitable, because there's a lot of street furniture cluttering up the street in front of the entrance there. There's a bus shelter and there's litter bins, and it's also a very heavily populated area, and it's often very difficult and awkward if you do have a disability to be able to access that. It's a very busy road as well, and there's difficulties with crossing the road as well. So it's not an easy journey, and it's not at all an accessible venue to go if you have to go there to access medication on a regular basis. If you had a choice, you wouldn't use that pharmacy. The problem is we have no choice now. I don't feel that we have anyway. What I have complained about is the cost of medication. You know, if you have to have regular prescriptions, even if you buy a season ticket, it can still be, if you're on a student budget, it can still be quite expensive. And there are students who said to me, look, I've got a chronic condition and I have to pay for my medication, and yet if I didn't take my medication, I'd cost the government or the National Health Service or whatever even more money. You know, so I feel I'm being penalised for being responsible. With nowhere to sit because all the chairs are taken, and obviously you feel that you have to give the chairs over to the elderly, and there aren't enough pharmacists to serve the needs of the population now. I think it was Munro's was shut down, was it? So that means that there's only one pharmacy for that very, very busy central population.